Can AI prevent falls in older adults? Our population is living longer. In 2021, in the UK alone, there are 10 million people who are 65 years or older. By 2050, this number will go up to 19 million. But what affects 1 in 3 over 65s and 50% of people aged 80 and over in the UK? Unintentional falls. Falling causes distress, pain, injury, loss of confidence, loss of independence, and mortality. In fact, every year, falls account for 95% of hip injuries in older adults, 9,000 deaths of over 75s, over 4 million bed days, and cost the NHS and social care around £4.4 billion each year. There are many things that cause falls, including environmental hazards such as loose carpets and poor lighting, as well as intrinsic issues such as muscle weakness, illness, or high blood pressure. However, many falls can be prevented. Using wearable sensors and AI algorithms, we are detecting the likelihood of an individual falling before it happens. The key to prevention is identifying intrinsic issues early and offering robust interventions. An individual's difficulty with strength, balance, and stability cannot be easily detected by a healthcare professional, as they are so nuanced, but wearable sensors can pick up these tiny changes. Data from these wearable sensors can then be fed into our AI algorithms to determine the risk of falls and highlight issues for further detailed assessments. Orbital Innovations, together with Suffolk County Council, are carrying out a study to screen older adults with a high risk of falls. Data collected in the study will be fed to our advanced AI algorithm, which will then look for risk characteristics and quantify their risk of falling. Once identified, there will be recommended detailed assessments or interventions to reduce the intrinsic risk of falls. The primary focus will be to filter patients in at-risk categories, such as those with Parkinson's, vertigo, stroke, and dementia.
One of the primary problems that we have in Suffolk is we've got an ageing population above and beyond the national demographic. And one of the key problems that we have, or key problems that older people face, is falls. So what we're hoping is that by utilising this technology, if we can understand the indicators that would lead to a fall before it happens, then we can be preventative in our approach, offer some support which might mitigate or stop that risk occurring, and therefore it gives that person a better quality of life, and hopefully they won't have an incident which impacts on them significantly.
Our ultimate goal is to reduce the amount of falls. This prevents unnecessary suffering, leads to longer and healthier lives for older adults, and would likely save the NHS over £630 million annually.
Hello everyone. So far, what we have seen is a falls risk screening system, which can identify an individual with risk of falls, and then we can do a further detailed assessment as to why the risk of falls is happening and offer them appropriate interventions. This is a great system. However, this is just a one-off measurement. A falls risk changes over a period of time. This can be due to the changes to the medication intake of an individual, or even down to the hydration level. Therefore, it is important to measure and update a risk of falls of an individual continuously. So the next project, our future project, is going to look into how we can measure and update individual risk of falls continuously using wearable sensors. So this system will allow us to prompt the users, the carers, and even the family members to take appropriate interventions as soon as the risk of falls is really high. This system will truly prevent falls in the future. Thank you.
Grand Challenges Explorations, an initiative of the Bill and Melinda Gates Foundation, a case study on predictive AI for improved healthcare outcomes in Rwanda. Rwanda is an East African country with a population of 13.14 million. The median age in Rwanda is 20 years old. Thanks to major health reforms, life expectancy has doubled over the past 20 years, For instance, the prevalence of TB has been reduced by a massive 81%. Despite such achievements, there are still several health challenges for the nation. The country also faces a large burden of mental disorders. Moreover, communicable diseases such as infectious hepatitis, HIV, acute respiratory infections, dysentery, and tuberculosis account for 90% of complaints at health facilities. Only 50% of the population have access to safe drinking water. So the question is, how will the healthcare system continue to thrive? Global health campaigns are an essential part of delivering effective health services. But without proper planning, the implementation of these campaigns can deliver services to people who may not need them while missing out those who do.
Health campaigns do have a lot of problems, especially starting from the planning, because there are so many stakeholders involved in trying to fill the gaps. But also the main problem is how the campaign plannings are being conducted. And how the result of the health campaign are linked to the campaign planning or campaign effectiveness. So the most challenge, the biggest problem in health campaign is the proper planning of campaign.
Yes, and I'm really excited about the fact that, when we use these AI, the Orbital Media showed us the preliminary results that showed that by taking secondary data sets such as poverty maps, geocodes, and adding it to the standard data that the government has, that if we put all those two together, we can actually identify better mobile sites of where we should be providing the services, where people are really living, and where we need to bring our services to.
Orbital are developing an application which uses AI to identify shortfalls and help microplan health campaigns for the Ministry of Health and other key stakeholders in Rwanda. This predictive AI technology will improve efficiency, effectiveness, and reduce costs associated with campaign planning and management, and ultimately make for a happier and healthier population. More about Orbital's solution. Orbital's predictive model incorporates data such as disease prevalence, distance to health facilities, poverty levels, and education to predict the locations where there is a high demand for vaccines or additional healthcare resources. This model will essentially identify how many vaccines, other treatments, or medical personnel are needed at each location, along with what proportion of available funds need to be dispatched to said location for maximum effectiveness. A truly positive impact. These health campaigns are data-driven and are highly effective and efficient, which makes for a healthier population. The Ministry of Health is able to microplan their health campaigns with ease using a web app. The predictive analytics also helps them decide the distribution of their available funds for maximum value. We estimate a cost reduction of at least 30% when compared to traditional services delivery.
Hello everyone, the next stage of the project will look into the real-world evaluation of the models we deployed for the Rwandan Ministry of Health. The invaluable data collected during the global healthcare campaigns is going to help them redirect supplies and personnel from the regions that no longer further require the services to the people who are really in need of them. With the aid of machine learning models, based on the latest status of the regions and hospitals, we will be able to identify the regions of the highest risk and accurately determine the number of medical supplies needed. This approach will consequently help the government to redirect the expenditures elsewhere, ultimately making the healthcare delivery system more suited for everyone. Once the new methodology has taken its roots, the focus will shift onto the collaboration with the local hospitals, collecting and analyzing routine medical data. This will help the stakeholders to identify underlying health problems in the country and help to plan logistics and medical supply management. The later stage of the project would involve scaling the platform for the more African countries that are currently attempting but struggling with global healthcare delivery planning. Thank you.